Tech giants are quietly taking over healthcare, and even though few patients or even doctors realize it, Google's influence over the US healthcare system is growing every single day. They're following a playbook that's helped them dominate and corner other markets. But in this industry, the stakes are a lot higher. In this deep dive, we'll examine how Google moved from search into the clinic and embedding itself so deeply into hospital workflows that unwinding it would be nearly impossible. We'll also take a look at the scandal that exposed just how far Google was willing to go and what they're building now. This story actually began over a decade ago, but it barely even made the news. In 2014, Google bought DeepMind, not for the flashy AlphaGo, which hadn't even made headlines yet, but for its AI research. By 2016, DeepMind had quietly partnered with the NHS to develop Streams, an app that alerted doctors to potential kidney injuries before they became critical. It was a quiet test of what might come next. Fast forward to 2018, Google launches Google Health. They hired Dr. David Feinberg, absorbed DeepMind's health team, and signaled that they were making a serious healthcare play. But it really didn't get that much attention at the time. In 2019, Google signed a 10-year partnership with Mayo Clinic to migrate decades of patient records onto Google Cloud and co-develop AI tools for complex care. Later that same year, they began Project Nightingale with Ascension Health, which would become one of the most controversial moves in the healthcare space. The story exploded in November 2019 when the Wall Street Journal broke the Project Nightingale scandal. In secret partnership, Ascension had allowed Google access to fully identifiable medical records from 21 states. Doctors saw their own patient's history being copied to Google servers without patient consent or notification. And it was all due to a loophole to get around HIPAA. HIPAA's business associate loophole allows transfer of sensitive patient data, so long as it helps with healthcare operations. But audiences saw beyond legality. 50 million patient histories quietly handed to big tech. But nobody saw how the data was processed, who trained the algorithms, or how decisions would change in the future. Looking back, Nightingale was a wake-up call. The moment big tech's hand became visible in what many thought was private healthcare. But Google weathered the storm and has continued their push into healthcare, armed with a playbook that has allowed them to dominate other markets. So why is Google even doing this? Healthcare is data intensive, responsibility intensive, and this is the important part, largely unoptimized. Whoever masters it could guide medical decisions and help billions, or a small select few. Let's start with the Mayo Clinic. Beyond storing data, Google's building machine learning models to tackle chronic and complex diseases, patterns humans might potentially miss. DeepMind built diagnostic models with UK hospitals analyzing retinal and chest imaging to spot diseases like diabetic retinopathy and pneumonia, matching the accuracy of human specialists. Practically, checking vitals, labs, doctor notes, and sending alerts before problems occur could save lives. But beyond the benefits of AI, the real pattern here is infrastructure control. This is the same playbook that helped them dominate other critical industries. Advertising, mobile, education, smart home. Basically, Google controls the infrastructure, shapes the data, and then lets others build on it. That's their strategy. But in healthcare, the stakes are so much higher. This isn't consumer tech, it really is critical care. What happens if algorithms flag ICU readiness or risk modeling influences triage decisions? Google becomes part of the clinical judgment circle. Google publicly gives their current offering for hospitals as smarter, faster, and safer healthcare, which maybe it is, but at the same time, it gives Google a lot more control. But they also have some competition from other big tech players as well. So we'll see how this develops over the next few years. This channel breaks down how companies win and lose with technology, so we can identify patterns that others don't. If you found this video interesting and you'd like to see more on corporate tech in the future, please consider subscribing. This is Tyler Detchover. Thanks for watching.